All right, welcome everyone. We've reached 12 o'clock Eastern time, so we'll get started here today. My name is Amanda Demmer. I'm the Learning Specialist and Program Coordinator for Community-Based Research Canada, and I'll be moderating, facilitating today's e-learning event. Really excited to be kicking off a brand new series we're running this fall about how community-based research can be used as a tool to respond to the crises facing our society today. We have a very excellent, very interesting session today um, from folks at the Youth Wellness Lab titled Amplifying Youth Voices in Research for Social Change. Um, so this is a really exciting event for us because it's a great bridge between anyone who is following our last event series on youth and engaging youth in community-based research and our new series looking at how community-based research can respond to crises. So very excited for the presentation today. As we kick things off, just recognizing and acknowledging that this presentation is being hosted by us at CBR Canada. Our secretariat is situated on the traditional territory of the neutral Anishinaabe and Haudenosaunee peoples. We are a membership-based organization with a mission of advancing community-based research excellence in Canada by strengthening partnerships, building capacity, mobilizing knowledge, and championing community-based research among individuals, communities, and institutions. We are a social enterprise. We're funded entirely by our membership base of currently over 70 institutions across Canada and beyond. And as part of our programming that we offer to members, we host e-learning events like these, as well as community of practice events, training opportunities, and other things that you can learn about by visiting our website. And I've pasted the link to our website in the chat there. In the spirit of reconciliation, we do open each of our e-learning events by reflecting on and amplifying the goals of the Truth and Reconciliation Commission's call to action. So each month I choose a call that is relevant or related to the topic to highlight. And this month I've chosen call to action number 21. We call upon the federal government to provide sustainable funding for existing and new Aboriginal healing centres to address the physical, mental, emotional, and spiritual harms caused by residential schools, and to ensure that the funding of healing centres in Nunavut in the Northwest Territories is a priority. So since we're speaking about healing and wellness and youth today, I thought that was a relevant call to amplify. Community-based research Canada is committed to continual reflection on the interconnections between truth and reconciliation and the various topics that we approach using community-based research. And we're also committed to engaging with and learning from diverse First Nations, Métis, and Inuit people across Canada and embracing Indigenous ways of knowing. So today's e-learning event, same agenda as always for folks who are new and perhaps joining our e-learning for the first time. We start off with a presentation, about 30 minutes from our wonderful team at the Youth Wellness Lab. We'll have about 20 minutes after that for a question and answer period where you get to pick the brains of the presenters and ask anything that's on your mind relevant to the presentation. And then we'll wrap things up, close, and get everyone out of here right at 1 o'clock Eastern time sharp. As we go through the presentation, we ask that folks keep their microphones off, keep themselves muted, so that we can give our full attention to the presenters without any background noise. I do encourage you, even though the question and answer is after the presentation, I encourage you to enter any questions that come up for you in the chat box at any point throughout the presentation. When we get to the question and answer, I will scan that chat and see if any questions have come in so far, and we'll get started with those ones. So please, at any time during the presentation, you can enter questions into the chat box. I'll welcome you to think and enter questions into the chat specifically when we get to that question and answer period as well. Our event today is recorded and it will be available on our website as well as sent out. The link will be sent out to all registered attendees today. So with that housekeeping out of the way, I'm very honored to be introducing the presenters today. Pam Batista, Dr. Stephanie Began, Hajar Sayed, Ayla Arison, and Bryn King. And I hope I've pronounced everyone's name correctly there. We have a fantastic team here to be introducing to you from the Youth Wellness Lab. So without further ado, I will pass things over to our presenters.
Amazing. Hey, folks. I am going to start off. My name is Cam Bautista. I have been with the lab for, I feel like is forever, but I think it's been like about 4 years now. I started off as a, a YEC member, which was the youth advisory council that we had here, and now I've worked my way up to research assistant. So yeah, happy to be here and talking about some of the work that we're doing.
I can introduce myself next. Hi, everyone. My name's Ayla. I'm one of the youth researchers at the lab. I joined in 2020 at the inception of the lab. I'd met another youth at a community group, and they told me about this cool research lab that they were kind of conceptualizing and asked if I wanted to be a part of it. And so I was kind of interested in pulling on some of my lived experiences to inform research. And I started as a youth advisor with CAM, just sort of like providing input on research design and like generating ideas for potential projects. And after that, I gained some skills and I became a youth researcher and I was able to have like greater participation and leadership in projects. I'm a student. I'm studying social work at York. I got a diploma in counseling and advocacy. And I'm also a pet parent to an absolutely unhinged cat. So, yeah, that's a little bit about me.
Hi everyone, I can go next. My name is Hadger. I was born and raised here in Toronto, so I think the purpose of the Youth Wellness Lab was really important to me, really just the focus on young people and youth in Toronto specifically. So I got involved, I think, in April 2022 when I came across the lab social media page, and I just knew from like the mission and vision and everyone involved, I'm like, oh my God, I need to get involved too somehow. So yeah, I've been here for around 2 years and I'm a youth researcher.
Thanks, Hatcher. I am also the pet parent to an unhinged cat, Ayla. He wakes me up every day, like right before the sun rises, doing parkour in the house. Anyway, he's not my friend. So my name is Bryn. I am faculty in social work at the University of Toronto. Co-founded the lab with Stephanie and Ayla and Cam and other young people who sort of started it with us. And we'll talk a bit more about that in a minute. I can't believe it's been 4 years. And I'm just very excited to be here with you all talking about our work.
And I'm Stephanie Begun. I'm so pleased to be here and thank you for inviting us into this space and to share a bit about what we've been doing. It is hard to believe that it's been 4.5 years that we've been around, and we're housed at the Factor in Wintash Faculty of Social Work, where I'm also an associate professor alongside Bryn, and have been with this amazing group since the beginning. So thanks again. I think we can go to the next slide, actually.
I think this is us, Stephanie. Do you want me to start or you want to start? Okay, I'll start. So we are a collaborative research hub. We've conceptualized ourselves as bringing together sort of three groups: youth who are interested in participating in research, design, and dissemination, particularly about their own lives; researchers who are committed to doing that same work; and like community partners across the service sectors where youth have interaction. At the core of the lab is this kind of youth-adult partnership, which you see kind of evidenced here. We work closely as it relates to all core lab work in partnership with our youth researchers. I think when we sort of originally conceptualized this was a kernel of an idea that Stephanie and I had in the summer of 2019. I mean, it was, we had always thought that we might do something around youth-focused research. We were sort of lucky to get this kind of small seed grant to build collaborations. We pulled together some faculty at U of T who also do youth-focused research, but more importantly, we pulled together what was then a youth advisory council to sort of figure out, and I think it was a tough ask for them at first because we were really committed to trying to build something without deciding what it was going to be before we did it, before we were working with the youth who would be our partners in this. And so many of our first meetings were like, what are we doing here? Well, I don't know. What are we doing here? So we did this, but we also did this in the context. Our first meeting was less than a month before the onset of COVID-19. So we built this partnership, all of the projects that we're going to be talking about today in the context of COVID and fairly significant social upheaval as it relates to the death of the murder of George Floyd, the Black Lives Matter movement, the discovery of what everybody knew was there, of the remains of children and former residential schools across Canada. This was the context under which we were thinking about research. I'm going to stop talking, Stephanie. There's probably more to add here.
I can just chime in too that while we thought at first we wanted this to be totally youth-led and youth-driven, we had this youth advisory committee that was off to the side, and we found that we were encouraging them to meet, formulate ideas for what kinds of research and what kinds of systems have failed you that you want to do research about and see your voice really represented in. And they had amazing and fruitful meetings. And then we realized that we also have research agendas, Bryn and I and other people who are involved on issues that really resonated with the young people who are part of our growing team. So sometimes we had grants or we had projects that they said, hey, I'd like to actually just be involved in that. And so it's not necessarily that they asked the question first, but it was something that they resonated. It resonated deeply with them. So as a result, concurrent to this, we also, because we're at U of T, we have various students, undergraduate, master's, doctoral students, and really since we've been around, we've even seen people move through those and up through those programs, which has been great to see undergrad students becoming master students and master students who have been working with us, eventually becoming doctoral students. And something that was really palpable about this sort of like you're inside U of T versus being on the youth advisory committee is that actually a lot of the age ranges were similar and actually a lot of lived experiences and interests in different types of research and systems were really quite similar. And we decided it makes almost more sense to just everyone's a researcher at the Youth Wellness Lab and everyone is a paid employee of the University of Toronto as a researcher, a research assistant, whatever. And there were so many people who are students here at U of T who had these important questions as well. And though they'd navigated their way into U of T without a foothold and without a place where they could have some belonging and have a chance to have their ideas heard and valued and build community, that the university system isn't always a very easy place to adapt or find your foothold. And so as a result, we all just became really like a flat team. We all have the same title and we all are involved in creating ideas as well as contributing to projects that were the ideas of others really uniformly across the board. And I think that's been really powerful. I think that's it.
So I'd like to speak a little bit about the key areas of focus. So there's a lot of overlap here, but they are kind of different in their own sense, and they're pretty broad areas. So we tend to use a variety of methods, both us as researchers and then also our partners that we engage with. It covers a lot of intersecting areas. So there's 5 here that we've kind of pulled out. The first being involvement in public systems. So think child welfare system, the justice system, the education system, all these systems that we kind of navigate as we move on through life. The second being housing and homelessness. The third being neighborhood and community health. the fourth being physical health and mental health, and then the last one being resilience and well-being. And I think some of these are kind of becoming buzzwords now, but I really do think that these are areas that, you know, are so critical to wellness and the way that, you know, we, like I said, move through life and think about our own identities and feel our best. So I think these are really areas that are important. And I will just say, I think these areas kind of came out of the expertise of Stephanie and Bryn, but then also through like the lived experience and the interest of the young people that are involved in the lab, and then also more broadly speaking about what we think young people care about. We'll probably move to the next slide now. Thanks, Amanda.
I can jump in on this one. So yeah, in terms of what we do here at the lab, I feel like it's so all-encompassing. We do a lot here. It goes way beyond what is listed on the slide. Yes, we've done literature reviews and data collection analysis and group facilitation, but in terms of just even specifically what I do, I feel like I have a hand in everything we do here. I'm involved in all this research stuff, but it's also really cool to be able to talk to the young people that were engaging in research. It's really cool to meet with community partners and like be involved in really key decision-making meetings and conversations that I feel like I've just like never been asked to be a part of, which is really cool. And just even doing things that I didn't know research could do. Like we, for first year and even this year of the Health Canada project, which we will be able to yap on a lot more later on in this presentation, we are doing so much in terms of like knowledge translation. We're creating these infographics or we're creating these different things that are really interesting, like a podcast and everything. So yeah, Hadger, Ayla.
Yeah, I can add on. I think that this role is really interesting to me because it kind of almost puts us in like a dual role where sometimes we're participants in like the research that we're designing, and then sometimes we're the researchers engaging with participants. So like we can be seen as peers to other youths, but we could also be seen as like professionals, or at the same time seen as professionals, which is more like synonymous with like a sense of adulthood. So it's kind of like navigating that that's really unique, I think, about the youth researcher role. But I do think like the beauty of that role is that it kind of like allows us to approach research from less of like a stuffy place. Like no offense to research, I love it and I love working with like the adult partners, but sometimes it can research like the process of it can come off as a little bit cold or uses all this like fancy jargon. And being a young person, like we often communicate differently and like experience the world differently than like a principal investigator, for example. So it really allows us to tap into who we are, our authenticity, like our lived experiences, and have that accepted. And I think that's what kind of leads us to engage with more creative research methods that make research more approachable for other youth and helps our outputs feel representative of youth experience. And I've also found that the lab takes a really hands-off approach, which I really appreciate. We're given a lot of space to lead and take on different aspects of research based on our interests and our capacity. And there's a lot of trust in us to write and analyze and seek out information. And I think that's something that I haven't found prior to being part of this lab. So it's really cool to have that space to grow personally and professionally. Hadra, I don't know if you have some thoughts to add.
Yeah, I think you summarized it so nicely, Ayla. I think for me, coming from a few different undergrad labs at U of T where I was a youth researcher, or the term really is research assistant. One, they're often not paid. Two, you really are doing work that they just kind of put on your desk and you might not really understand the point of it. So I think this lab does a really good job of kind of flipping that and being like, you are a youth researcher, you have opinions, you have a voice. Where do you want to go with this research? And I think the lab is really accepting and, you know, really open to new ideas and new experiences and different ways of like looking at problems and different methods as well, like Ayla mentioned, right? It's not just we're doing this research, we're gonna put out one paper and then present at one conference. That's never really the format here. It's more like how can we give back to community? And I think that's a big part of it, right? Like not just being tokenistic and really understanding that this is grounded in community, and part of that is grounded in the lives of young people.
Pretty sure this is my slide, but yeah, in terms of what we're going to speak on specifically today, in terms of our projects and what we've been doing, we're first going to speak on the Real TO project, and then the Young Parents Study, and then the Card Access project. The Real TO project. So I feel like this was a really interesting project. We had done this, well, I'm trying to remember the year now. A few years ago, we had done this entirely online because this was still, oh no, I think it was 2022, right? Yeah. There was still COVID stuff going on in quarantine. I don't think it was as intense as like 2021, but it was still like entirely online. We had done an Instagram live series where we had engaged with a bunch of youth from our own lab and youth from the community who came forward with ideas and topics that they were just like, yeah, this is really important to us. These topics, these issues are things that we want to speak more on, that we want to have a platform to really amplify these things and to be able to be in conversation with adults who are either working in this field or who have some kind of expertise to kind of like round out that conversation.
Yeah, and we also did episodes that were kind of like peer-based too. There was a range of topics that we talked about. One of the things that I liked about the series is like it was very youth-led. Like every single young person who hosted an episode was involved from the very beginning, was very like they got to choose what the topic was, what the questions they wanted to ask. They got to invite the person that they wanted to. And a lot of the things that we chose to talk about were topics that have a lot of stigma surrounding them, I felt like. And I think it was a really good way to bring more people in on conversations that are, or issues that are misunderstood. For example, I led an episode about coping with substance use. I found that during the pandemic, myself and a few people that I knew were really having a hard time managing like the isolation and all of the changes and unpredictability. And there were a lot of risk factors, especially for marginalized youth, that increased during the time of the pandemic, like declining mental health and lack of employment and domestic violence. So I found that in my circle, at least, one of the things that youth were gravitating to was coping with the use of substances. So I really wanted to open up a conversation about that. And I invited somebody who I felt could talk on that topic and I got to choose that person, and that helped with just I guess what's the word, implementing the episode, because I had that level of comfortability with my guest. So that's just one example of an episode that we decided to do.
Yeah, going off of everything that Ayla had said, I feel like these conversations were so meaningful, I think, because it was done in such an accessible way, you know, and we did it on Instagram. We did it in a space where young people are that they feel comfortable using, that they can access and see. And I know for the episode that I had done, I'd spoken with Bryn actually, and we had spoken about um, like being queer and being a practitioner in like a community kind of facing field. And it was I think these conversations were really interesting in how people like came together because, you know, on Instagram Live, we have the comment section where we can see people engage. We can see people like send in emojis, and we can see people just um, they can talk about and engage in real time what it's like. And I think that's a really cool way of how the lab does it. We're so in tune with community, and we're trying to find ways to engage and kind of meeting them where they're at, because research feels like it's so far removed sometimes. And especially with some of our outputs, like our papers can take forever to get out and done, and they're not always accessible to the folks that really need to see that kind of thing. But in terms of our episodes, those live on our Instagram. People can go back and watch them. People can always go back and see those things. And I think it's really cool to have these different outputs that we have where people can engage, because it's not just about, getting this information out there. If it's not done in a way that's accessible for folks, or in a way that is comfortable or meaningful for them, then what was the point of doing this work, right? Was this work really for the community, or was it really just for us and our own outputs? So yeah, I think we can move on to the next slide.
Okay, this is me. I'm going to talk about another project called the Young Parents Project. This was a project that sort of came from community. This is focused on young mothers' involvement with the child welfare system. I was approached by a community partner who wanted to better understand how they were serving young parents. A community partner, a Children's Aid Society, wanted to better understand how they were serving young parents. At the point at which we were implementing this study and starting data collection, it was also around the same time that birth alerts were stopped. And so there was a lot of sort of energy around thinking about, how are we responding to particularly marginalized parents in the context of healthcare settings and child welfare responses. And for those who don't know, birth alerts were a practice in which Children's Aid Societies or child welfare agencies would send out an alert to the hospital. To set up an alert so that the hospital would notify CAS when the baby was born, and in many of those cases, the baby would be apprehended from the hospital. Ontario put a stop to them because they were disproportionately impacting Indigenous mothers, First Nations mothers, and more broadly, these practices were highly racialized and deeply troubling. So those have been put on pause, but the sort of context for this study is that young parents and particularly young mothers, are reported quite frequently to the child welfare system. There's a lot of research that sort of documents the risk factors associated with being reported, but there is very little that sort of speaks to the experience of young mothers once they become involved. I'll stay here and then we can go to the next slide in a minute. We conceptualized, there was several components to the study, but one key piece was really trying to understand that experience from the perspective of young mothers. We were about to do data collection, and then we were all set to start recruitment. And I think we'd already started recruiting, and then COVID hit. And so our plan for how we were going to do data collection and do recruitment sort of had to be thrown out, and we had to really rethink how we wanted to engage with young mothers who were also dealing with the things that Ayla sort of referenced, the social isolation, the stress of COVID while parenting, and while also sort of either currently or having had historic experience with the child welfare system, which really we now know, we suspected at the point at which we started doing data collection, but we now know there's this sort of constant fear of surveillance anyway. So this real tension around I'm isolated, and I might need support, but the only folks that will show up is child welfare. Anyway, so our team, and this particularly the team, that engages with our participants in this study, are all mothers. Particularly, we had 2 out of 3 of the interviewers who were and had been young mothers, and they were sort of approaching this work from that lived experience and engaging in those conversations from a place of resonance and understanding. And these were while there was a structured interview on which they had lots of input on developing that interview guide, much of this was a conversation led by them. Ayla reminded me, and it's that this was also an episode in the Real TO. We had one of our youth researchers who works with the lab, but is also an interviewer for the study and a researcher on the study, bring somebody that she works with in the community to talk about the young mother's experience, particularly for young Black mothers. And so we've been able to, we can go to the next slide. We finished data collection in 2022, and we've been working on several sort of analyses and papers. The person that I referenced, Promise, who works with the lab, was able to leverage these data that she was part of collecting and analyzing into completing she used them for her master's thesis. So she just defended her master's thesis last spring, or actually very recently, the end of the summer, I think. And so, her master's thesis was on the specific experiences of young Black mothers involved with the child welfare system. We've been able to sort of, in our work together, do several papers. As Ayla said, they take a while. So we've published one. We are working on 3 others, and the other thing that we didn't really talk about when we were talking about the Real TO was kind of the training that we did around coding qualitative interviews. So in addition to the actual series, we did post episode debrief sessions with participants. We did, and we used those data to sort of understand what the experience was like for folks who participated in the series. But what was really fantastic about it was one of our PhD students, who was also a guest on the series, who has a lot of expertise in qualitative research, pulled a whole bunch of folks together, youth researchers, to sort of train around qualitative coding. And so we spent a summer where this whole team was coding together, doing like team coding in Deduce, and really working together to sort of identify themes and identify patterns in the themes. So I borrowed from that expertise for this study and really carried it over. I mean, so we are like training in this work. It's like this sort of peer training model also, where we're sort of leveraging the expertise that is garnered in one project into another. And so, I think I'm going to stop talking, pass it on.
And one final project that we will cover a little bit is the CART Access Project. CART stands for the Contraception Abortion Research Team, which is housed out of UBC, and I'm the director of social work research for that. It's been a really prolific and important group in not only researching, but influencing policy and practice across Canada around a range of different reproductive and sexual health outcomes, including contraception and abortion. And I appreciate that this webinar series is kind of thinking about responses to crises. And I think this is another example. Really our lab was founded at the beginning of a series, a cascade of crises with COVID, and with so many dimensions of anti-Black, anti-Asian, anti-Indigenous racism. And this is another example of that, because as we saw Roe v. Wade overturned through the Dobbs decision in the US, Canada has chosen to do a very different thing, which is actually invest more in research on making abortion more accessible and more affirming to groups who have really been denied equity in this area and have been denied access, and who have had really terrible experiences in accessing abortion, despite it being available and legal and generally free here as well. So the Health Canada and the Government of Canada chose to put out calls for proposals on projects not that long after the Dobbs decision was delivered in the US. And CART was approached to conceptualize some things that we think are important to research in that landscape. And through this, I really wanted to get the Youth Wellness Lab involved in researching in this area, because I think that young people will have different questions and are dramatically impacted by abortion access. And I don't think we know enough about their lived experiences, even myths, seeing friends, seeing family members themselves going through different experiences, and use this as an opportunity to say, is anyone in our team interested in joining this project? Would you like to do youth-led research around the topic of abortion access across Canada? And it has really turned into such a beautiful and powerful project. We were actually extended in our work. So now we're in the second year of our project, and we're hoping to actually continue this for years to come. It's an amazing youth-led project, and the folks on this team, Hadger, Cam, and Ayla, are all key members of that team. So I think they should talk about it. But that's sort of a response to a crisis, in that we have an opportunity to do something quite different here than perhaps our neighbor to the south.
So I can speak to the next slide. Thank you. This is a lot. I think I'll give you a bit of backstory before I actually delve into what's on screen. So Stephanie did a great job of kind of giving you an overview of the Card Access project. We're in year 2 now, but I would like to talk about our first year and what we did as a team of young people. So we identified healthcare providers across Canada, and we really did want to focus on folks from across Canada and not just have practitioners from the GTA speak to their experiences of providing abortion. So, for example, like OBGYNs, family doctors, pharmacists, nurses, midwives, etc. A couple of different groups, I think 7 in total, of different healthcare providers that are talking to young people specifically about abortion access and services and care. And we really wanted to get their experiences on what it looks like for them. And so some of the resources you see on the screen will either be resources that we've disseminated with them. So this could be like an infographic they put up in their waiting room, or like a checklist that they have at the side of their desk, really just to focus on things that they can do to make their spaces more affirming. And then also some of them are just, checklists and different things that we thought were really important, an accessible way of like sharing information that we think young people really care about and we ourselves had questions about. So for example, I made the next one on one-on-one infographic, and I think each of us has an infographic here that we can speak to, but this was one that was important just because it was guided by my own interest. I'm like, what is Nexplanon? How does it work? How will it interact with other medications I might be taking? So I think we kind of all just chose a topic that kind of came about naturally. We're like, oh, this is something I'm interested in, or oh, this is, myths that we've heard about and I want to be investigating it more. So I think the way that we created the resources came about in such a nice way, where we're like, oh, we see that there's a need for it, but then also we've been impacted by it in our own life, or we're curious about it, or we heard from the interviews we did with the healthcare providers that this was questions that they have, or there would be like, they're like, oh, it'd be so great if we had a resource about this, or it'd be so nice if we can put up some sort of, poster in our waiting room for, this specific population to feel represented or cared for. So that's kind of how the resources came about. In terms of the second year of activities now, so for year 1, we talked to healthcare providers. In year 2, we're really talking to young people from across Canada, so aged like 15 to 29, I think is our age range, just about their experiences accessing care itself and abortion services, abortion information, whether they've had an abortion themselves or not. Like, what are your opinions and how does this impact you? In terms of like the knowledge outputs that we're kind of working on, obviously there's, papers and conferences, but there's also a podcast that some of us are leading. There's different infographics that I'm sure will come out of the work. But yeah, that's like an overview. Cam, Ayla, I know both of you have posters up, so maybe you want to speak to that.
Sure. I can quickly talk about mine. So the one that I created is, I think it's on the far right. It's the social workers abortion access checklist, and this sort of just came out of my analysis of the transcripts of the interviews that we did with the healthcare providers. I said earlier I'm studying social work. At least I think I said that. So I have an interest and passion in social work, and I noticed in the transcripts that there was sort of a range of perspectives in how social workers go about their practice. So this list is a culmination of like the tips, the wisdom, the knowledge that they shared through our interviews with them, but it also tries to fill in some of the education gaps and accessibility gaps that were identified in those interviews. We did talk to some MSW students who said that there was like nothing in their curriculum about how to support someone, support people who are accessing abortion. So yeah, I really wanted to create something that could easily be looked at to fill some of those knowledge gaps. It's not like an exhaustive checklist, but it's just sort of like an introduction to the kinds of needs that maybe a young person might have when they are coming to a social worker and wanting to access an abortion. Just thinking, just a way to like critically think through some of the factors that might be surrounding their life. So just thinking like, does this young person need like access to low cost care, and am I able to provide that? Or, is this, do I know about gender affirming doctors if I'm working with a trans youth, and am I able to refer them appropriately? So just thinking a little bit more thoroughly about people's lived experiences, and then I hope that this checklist can support social workers to support their clients.
And that just leaves me for this slide. I can speak to mine really quickly. I had created the purple looking one that has sticky notes on the bottom. It's the affirmations for trans and non-binary folks. So I thought that was interesting. Mine was a little bit different compared to some of the infographics we had created. And that one was really influenced by a lot of things. I mean, when it comes to abortion, I think that it's still I think the research and sometimes how it's spoken about socially is still thought of as like very binary, very like women, you know? And that's simply not true. Anybody can get an abortion at any time, at any place in their lives for whatever reason. And I think, that just um, erasure of trans and non-binary identities and their experiences is just, it happens a lot in any like topic or field, but especially in abortion. And I think that makes it so there's clearly not very many resources. Like when I was doing this research, because a lot of practitioners will mention like trans and non-binary folks, we need more resources for them, but they couldn't really speak to what would be good for them. Like what is out there? They don't know. What would be good for them? I don't know. And so when I looked for trans and non-binary specific abortion resources, there was really nothing except for tangible things like, oh, this clinic is like LGBT friendly. And I'm just like, well, I don't think that's enough. I think trans and non-binary folks needed to be named specifically. They needed to be named. Their needs needed to be, specifically addressed, especially as it relates to like the feelings that come up. This affirmation list I made specifically for trans and non-binary folks, but I mean these affirmations can be applied for anybody, right? And I think that we had mentioned that at the lab, our work is influenced not just by like the expertise of Bryn and Stephanie and the research that we're doing, but it's also inspired by your interests. And I feel like that was a really good example of something that I felt really passionate about because of what I was hearing, but because of my own like experiences and identity, and how I wanted to kind of sprinkle a little bit of that into this project. And I thought that was really meaningful to be able to do that in this way, and also in some of the other outputs that we're currently working on for this year. And we can move on to the next slide. Amazing. I think I'm the one who's speaking on this. But yeah, in terms of some of the stuff that we're working on for this year, as we mentioned, our podcast, it's We've already recorded a few episodes. Some of the topics we have looked into include things like anti-choice, kind of like protesting on campuses. And then there was one that Ayla and I had hosted recently about grassroots abortion advocacy. Some of our upcoming episodes include abortion and the law, speaking to someone from an organization named Leaf, and hopefully an episode with a birth work collective from the Northwest Territories. And here is, I guess, the end of our presentation. This slide and then the next slide has our contact information and our social media stuff.
Excellent. And these slides will be posted on our website along with the video recording. So folks don't have to feel that they have to note down all of this contact information. You can find that in the slide deck that will be shared. So thank you so much, all of you, Ayla and Hajar, Stephanie, Bryn, and Cam. It's so excellent to hear about the incredible work that you're doing. We'll transition now into a question and answer. We have about 10 to 15 minutes for this. So I haven't seen any questions come in the chat yet. I welcome folks now to enter your questions into the chat. I'll stop the screen share here. We can see each other's faces, and if you'd like to come off or come on camera, I guess, so we can see some folks' faces, that's always nice in this digital world. And I see our first question has come in. So we have a question. How does the lab approach building supportive and safe wraparound environments, since peer research, especially for young people, involves significant emotional work? Typically, universities don't have processes or environments in place to support this. So I'm very interested in learning how it can be done. I think that's a really great question. So I'll open this up for whoever would like to start answering.
I could start with this one because it sort of comes out of a paper that we recently finished. This is the RIP project for those internal to the team. And one of the things that, so I don't need to go into a lot of detail, but we ended up doing this sort of consultation process. We were going to be part of collecting data, but they didn't want to go through ethics. And so we didn't want to do that. So we were just hired as sort of folks who were documenting this. And we decided to sort of turn it into a research project. And this was consulting with young people who had been in care and were transitioning out of care. And so Stephanie, Cam, Ayla, and I, and many of our team members were sort of part of doing these consultations. And one of the things that we sort of put in place was like this debriefing session afterwards, and paid people. So I think like the answer is that you build it in as part of the research. You say, this is a requirement of what we need to do. We pay people for their time to talk about the experience of being part of that. Even with that, it wasn't quite enough. Like part of our findings was, yes, this was important, but it's still, there were lingering experiences and feelings. And so, yeah, speaking to and hearing about your own lived experience as a researcher, and especially if you don't have a lot of opportunities to debrief, can be really challenging. So that's just one thing. There's probably more that others could say.
I'm not sure if this is going to quite touch your question, but I just wanted to point out like the relationship building piece is really important for us. I think a lot of our supports are like more informal, like we'll have like group chats, or we know that there's like someone on the team who we can reach out to if like the work is getting overwhelming, or if it's bringing up emotions, or there's been times where I've been struggling with something in my personal life, like trying to find housing, or like I mentioned, my substance use issues. Like I know that I can go to Stephanie or Bryn and ask them for support, and they'll direct me to resources. So sometimes just tapping into those relationships and connecting on really personal levels helps a lot for the space to feel supportive for me.
Yeah, I was going to go off of that. I think, to have a level of safety or comfortability in a space, that takes time. You know, I've been at the lab for a few years. I was one of those very skeptical people at the beginning who was just like, what is happening here? I am not the most confident about this, but I'm still here 4 years later because the lab has done, I think, a very good job of tapping into the relationships, as Ayla mentioned. Even now, when I am leading some of these projects, we're doing youth interviews. Like, I make sure that I check in with folks after, and I'm just like, how was that for you? Are you okay? Like, the conversations that we have with young people, we always make sure that we ask them if they're okay, but we also have to like take care of each other and be like, hey, are you okay right now? Like, do you like these resources that we created that we give to young people, these are also available to you. And we also really care about each other in our work. So having that, I think, personal touch in our work really makes it so things feel safe. And also having youth on the team who have some kind of lived experience, I think helps, because we're going to miss things in our work or some of the processes we build when we just don't really have that background. Research can tell you a lot, but it's different when somebody is there who has that experience, who could be like, oh, maybe not do that, or maybe like tweak this a little bit. So it's a little more, youth friendly.
Mhm, mhm. Oh, that's great. Thank you all for sharing your perspectives on that. It sounds like there's, a lot of intentional effort put into that, and letting the youth that are part of the research team guide that process and really speak for what their needs are. So that's excellent. We've had quite a few questions come in and not a lot of time to get through them. So one of the questions was around how does the lab determine which projects or area you'll move forward with if there are, so many different topics of interest within the team?
I can start. Sometimes it's driven by something that we already know that we know something about or that we care about, and there's funding to go forward with doing so. So this has sometimes been like I said earlier with the card access project, we had funding coming in. This is something that's my core research area, and then as I've gotten to know folks on the team, I realize it's one of their key passion areas too. So we talked about it, like, is this something you want to do? Should we try to involve other young people from the community in being a part of this team? Do you have the bandwidth to do this one, right now? So sometimes it's like an opportunity that's kind of coming to us by way of something that we know about. Sometimes it's like, oh, it'd be so cool if we could do this project. Let's go seek funding for it. So it's just like an organic idea that's brought forth from the team. So it's a little bit of a mix, but I think like we're not doing projects on things that we have absolutely no knowledge of at this point, but that could change if there was someone who came into our mix or our team who's like, this is what I care about, and it fell kind of under the umbrella, we would certainly support it. But we've been sort of on brand, so to speak, with things that we've always been researching, perhaps Bryn and I, and that youth on the team have identified that is equally important to them as well.
We also have a bit of a parking lot where there are things that we've talked about that we are, have not gotten funded yet, or we haven't been able to implement yet, but are sort of in the hopper, and we're always sort of thinking about it and coming back to.
Sounds fairly typical in terms of research. It's that right timing of there's funding available and there's the interest and expertise and trying to make that work. All right. One of the other questions we have is how does the lab approach including youth who are outside of academia or kind of the elite institutions?
Well, I'll just say, we started out with Cam, Ayla, and several other folks that came from the community. So we I think our aim is to have both, right? Like, folks who are internal to these institutions that haven't found a place where they feel like their voice matters, and also youth in the community who might want to be engaged in research. Cam talks a lot about the ways in which being here, and I'm trying not to speak for you, Cam, but this is sort of where it comes in, is the like having exposure to research, and the university makes their own sort of academic work less intimidating and less overwhelming and really accessible. Like Cam, I think, tested out of research for in their own program because they already knew so much about it. Is that I'm accurate in that, right, Cam?
You are, yeah. I guess I can kind of speak a little bit more on this. For year 2, we're trying to engage with different youth across Canada. Yeah, I feel like it's always hard, to engage youth who are outside of elite institutions in academia, especially when you think about what communities are going into. If we're, trying to engage communities who have already been, super studied and might not have had the best relationships with research, that's always going to be super difficult. So I think for us, I think it helps when we can leverage some of our existing relationships in the community. I think, if the call is coming from people who it's always going to be like really, what's it? It's going to be more trusted, instead of like getting this random email from someone being like, "Hey, do you want to participate in this research?" That's a little weird sometimes, because you don't know who it's coming from or what their aims are. But I don't know. I think it takes a lot of work. I mean, when it comes to research, I think it's also really important to think about how you're engaging when you're not asking them for something, right? Like, how are you going back to them? How are you showing that like your participation in this study has helped, is meaningful? I know that in our work for the second year of Health Canada, we're letting the young people know that, there are opportunities to help co-design or help like review feedback and everything for the things that we're creating. Like, we're not just taking what you're saying and running with it. Like, before we even let this loose into the world, we're making sure that like we're getting it right based on what you told us, and that like this is the way that we've represented and understood your words and your experiences is actually being done in a way that you're comfortable with before we set it out.
That's come through in, I think, a lot of the way you've spoken about the projects, just that like the true partnership and authenticity in the co-design process.
I was just going to add on to what Cam was saying too, that like we're even with that, when we go back to kind of share our results that we collect in this year from and with young people across Canada, we're not only remunerating them for their interview participation, but then when we go back to them, we're going to offer again, would you like to be part of actually designing an infographic or a resource that you can take back and use specifically in your own community, or that is customized for something that you think would be helpful in your context, and we're offering to remunerate them again. So we're never extracting, or the goal at least is to not extract without remunerating. And it's like if that could be someone's foray and say, a different context outside of the GTA, that, wow, I'm part of research. I just designed this thing with this team from this lab. Like maybe that encourages them to get involved with us too, and allows us to expand in kind of nice organic ways in that way too.
Mm-hmm. It sounds like a lot of, that autonomy and that opportunity to take leadership is provided to youth, which is such a beautiful way to provide that kind of empowerment and those opportunities. So we are almost right at 1 o'clock, so I'll do a very quick wrap up. I know there were a couple questions that we didn't get to. I'm sorry for that, but perhaps folks can connect a little bit offline. We do record the webinars, so if anyone would like to rewatch this or circulate this to anyone else in your network, or perhaps watch previous e-learning events of ours, you can view those on our website. I've posted a link for that in the chat. We would also love for all of you to stay in touch with us here at CBR Canada. Many of you are probably already signed up for our e-news. That would be how you heard about this event. But if you're not already, you can sign up to our newsletter and put the link in the chat for that as well, where you'll hear about our upcoming events. And just a quick plug for the next event in our series. We'll be highlighting a group out from Edmonton and a presentation titled Centering Community, Health System Innovation in a Polycrisis Age. So we'll be very excited for that second event in this series we're running and hope to see many of you back for that. Thank you so much for joining us today. Thank you for the participation and the wonderful comments and questions. And of course, thank you to each of our presenters for being here with us. So we hope to see you all again at future events, and I hope everyone enjoys the rest of their day.